I have with me Dr. Dan Poulter, who is the MP for Central Suffolk and North Ipswich, and he is also Under-Secretary of State at the Department of Health. Tell me, Dr. Poulter, this magnificent facility is clearly designed to deliver the best possible experience for patients who are seeking some GP assistance. Does it represent a model of a change in delivery of frontline care, or is this part of a programme of relating it to A&E and hospitals?
Well, what you've got here is a GP surgery which is rooted in the local community that has now a fantastic new facility, not just to provide services, traditional general practitioner services, but also to provide other health services on site as well. There's a pharmacy, you've got health visitors on site to support young families and give children the very best start in life. You've got a close working relationship with adult social services and the county council to make sure that older people get the care and support they need in a joined up and integrated way, and you've got specialist facilities here as well for mental health. So there's a lot of very good things happening, and it's a new facility, and it's putting everything in one place so that all the health service can work together in a joined up way for the benefit of local patients. And that's
so it's a one-stop shop for everybody.
It is a one-stop shop, but that's good healthcare, because all that means is that people are going to be looked after in a joined-up way. So people aren't going to have to see one professional in one building and then go somewhere else for another service. But if someone has a problem, then there can be joined-up work between the health visitors and the GPs. If someone needs a minor operation, there are facilities now to have diagnostic tests on site, and that close to home care. And that's particularly important for elderly people. There are a lot of older people in Felixstowe. 12% of the patients, that's about 1 in 8 in this practice, are older people over 75, and they're going to get a much more joined up approach to their care. And there's a lot of really tremendously hard work that's gone into this, led by the local GPs and the community to drive this forward, and Therese Coffey, the local MPs, put a lot of hard work in as well to make sure she's advocated the needs of this surgery, and it's going to be really good news for Felixstowe in the years ahead. And the other good thing is if the population grows in Felixstowe, there's capacity for this practice to grow, so it's been future proofed in that respect too.
Are there other examples of similar practices in Suffolk?
Yeah, well, I do a lot of visits both within Suffolk and also within the whole of the country, and this is exactly the sort of modern healthcare facility, joined up approach to care that we need to see elsewhere. We've got many good GPs, many good frontline healthcare professionals, but what we're now seeing is investment on the ground to support those dedicated frontline staff to work and better support them to look after patients. So as well as improving the quality of care, presumably this has a beneficial impact on waiting times, on the speed with which people can be referred from one specialist to another? Absolutely, and what this surgery will be offering is the opportunity to have joined up working with Ipswich Hospital. So when, for example, someone may be able to have a day case operation close to home in Felixstowe or a diagnostic test, that means that takes pressure off the hospital, but also people will have less far to travel and can be looked after closer to their own home, and that's a very good model of care. And the big challenge that we all face in the health system is to have not just more joined up and integrated care, as is going to be offered here, but also to support people with long-term conditions better in their own homes and their own communities, and that's what this surgery is going to offer, and that's really good news for the people of Felixstowe. Fantastic news for Felixstowe. Thank you very much, Dr. Poulter. It's great to see you here today. Thank you very much. Pleasure. Good morning, everybody. It's a real pleasure and a privilege to be with you today, not least because it's nice, as a minister I travel to all parts of the country. The best part of my working week is always coming home to Suffolk. But it's great to be opening a fantastic new healthcare facility here in Suffolk and here in Felixstowe. And you have some dedicated and hard-working frontline staff, the GPs, the pharmacists, the health visitors, the receptionists who look after patients. You've got some fantastic staff who work in this practice, and they're now going to be able to deliver care in a better facility, in a facility that's going to really do the very best for local patients. And this is a practice that is now offering cutting-edge facilities to patients. You have here a integrated model of healthcare delivery. You've got GPs working alongside health visitors, working alongside pharmacists, you have day case procedures that are possible, you have care for people with dementia, with mental health, support for young families in this building, all together in one place, and a 7-day-a-week pharmacy. And there's going to be more joint working with Ipswich Hospital to make sure that there can be day case procedures provided here, so that older people and frail residents do not have to travel and can have close to home healthcare. This is how the NHS should be. It's the very best of the NHS. We're very proud and lucky to have this in Suffolk. There's been a lot of hard work that's gone into making this a reality. Hard work from the GP partners, hard work from the local community, hard work from your local MP, Therese Coffey, to champion the cause. And it's a huge privilege to work with Therese and have somebody who is a very strong advocate for Suffolk and a very strong advocate for Felixstowe in Parliament. But this has been a tremendous community work and community effort. People have come together to deliver this. It's been a long time in coming. Well done for making this a reality. This will provide fantastic facilities for patients, not just today, but in 10 and 20 years' time. And I'd like to put on record my congratulations to everybody who's made this possible. It's a team effort. It's a truly fantastic facility and a great credit to everyone who's made it possible. It will mean that the very highest quality of patient care can be delivered in Felixstowe in the months and years ahead. Well done. Thank you for inviting me to this day. It's a huge privilege and pleasure to officially declare this surgery open.